Manal El Sayed. I'm a professor of pediatrics at Ain Shams University in Cairo. I'm also the director of the Clinical Research Center at the Faculty of Medicine at Ain Shams University, and I'm a founding member of the Egyptian National Committee for Control of Viral Hepatitis. Well, I've been attending EASL for more than 20 years now, and I've been a member since the year 2000. And this, of course, is a very unique experience, the Digital ILC. Although it's a great experience overall, but it a little bit lacks the social experience, meeting colleagues and meeting friends and talking to them and making live discussions. However, I think during the COVID crisis, despite the fact that it affected so many things, I think the program is fantastic and gave us a great opportunity to see what's new and what's happening in different parts of the world. I've just been attending the EASL Foundation session, and I found it very interesting. There are very interesting projects. The first one was relating to the centers of excellence that the EASL Foundation is creating in collaboration with different countries. The one presented was in Georgia, and Georgia was supposed to eliminate hepatitis C this year, but the elimination goals have been postponed to 2023. And I guess this is because of the COVID-19. However, what they gained is that they're integrating also testing with other viruses like HIV and tuberculosis. The other one was the Consortium for Regenerative Liver Disease and the regenerative hepatology. And I think this is a very interesting and sort of futuristic project, and a very, very important project. And I think that 2 fellowships were given this year for regenerative hepatology. They are working on bioengineered liver mass, bioengineered bile ducts, and they think that this is the low-hanging fruit. And it's supposed to help a lot of patients with metabolic liver disease in the future, and it's supposed to compensate also for the lack of donors or shortage of donors in many countries. And this program, interestingly, any country can apply, or any institution can apply for this program to be part of the collaboration. They've been stopped a little bit because of the COVID pandemic. We are hoping that the funding will be sustained for this very futuristic kind of scientific program that is hopefully going to help many millions in the coming years. The third one was really interesting because it's real advocacy for the NASH. Jeff Lazarus gave a lecture about what they're doing now with the EASL Foundation in NASH. There is a big consortium now. They're working with many collaborators and stakeholders, and they want to shed light on NASH that is often overlooked, even in the non-communicable disease movement, even with the Sustainable Development Goals, or even under coverage of the universal health coverage of WHO. And what they've done is that they've done a review of the data and systematic reviews for 90 countries now, and a review of policy. And they're collaborating with the economy intelligence, and this in collaboration with 40 countries in both resource abundant and resource limited settings in Asia, Middle East, and Latin America as well. And they are working also with a big think tank, which is Wilton Park from the UK. And this is supposed to advance the policy for the NASH and the NAFLD. And I think this consortium, when successful with proper funding, they have lots of meetings and workshops in the coming few months. And by next year, it's expected that this consortium will be huge to guide and inform policies for NASH in the future. This is really important. And one of the questions it was a burning question for me, whether this includes also children. And I was glad to learn that this also includes the pediatric population that's often overlooked. Maybe this is something that was supposed to be part of the big conference, not the digital one, but it's a little bit undermined, which is the pediatric population. There's only one session tomorrow, and I'm looking forward to attend this session. However, the pediatric population has a little bit been overlooked. But overall, I believe it's a brilliant experience. It's a great experience. And I believe that maybe in the future, a sort of a hybrid meeting would be fantastic, and maybe collaboration and registration of institutions, particularly in resource-limited settings, where the younger generation find it very hard to travel to EASL and get visas to European countries. This would be a fantastic opportunity for them to learn and advance their science in the future.